Good afternoon. I welcome you all to this webinar on ensuring the integrity of samples in laboratory settings. This webinar is brought to you by B Medical Systems in association with ETHealthworld. My name is Prabhat, and I will be moderating this discussion. India has a very diverse population, which can provide biological samples that can become the basis of a lot of medical research and advancements. But maintaining the integrity of these samples for storage is critical for scientific research across the industry and medical diagnostics for patient care. Thus, good storage practices of biological materials are an essential component of any laboratory. The reliability and accuracy of laboratory tests results heavily depend on the integrity of samples used. To shed some light on this topic, we have healthcare practitioners across the industry. We have with us today Dr. Anita Mahadevan, Professor, Department of Neuropathology, NIMHANS, Dr. Sonal Saxena, Director, Professor and Head, Department of Microbiology, Maulana Azad Medical College, New Delhi, Dr. Nimi Kansal, Technical Director, Clinical Chemistry and Biochemical Genetics, Dr. Lalpat Labs, Dr. Suryasnata Das, Additional Director, Department of Laboratory Medicine, JP Healthcare, and we have with us Dr. Madhura Rekha, Founder, Director, Vijaya Rekha Life Sciences. And I'm sorry to announce that Dr. Varsha Poddar, who is a Senior Research Scientist, Head Influenza Group, Indian Council of Medical Research, National Institute of Virology, won't be joining us today. Before we begin, I would request the audience to share the questions in the chat. We will address them as time permits towards the end of the discussion. Before we dive into the topic, it is important to establish what we mean by ensuring sample integrity and why maintaining sample integrity is important in a lab. So my first question goes to Dr. Sonal Saxena. Dr. Saxena, what does sample integrity mean to you in your domain of expertise?
On a very, very important topic, which we deal with on a daily basis. And as you rightly said, what does sample integrity mean to me? The sample integrity is that give me an option that, yes, I am standing next to the patient. And when the sample reaches me, it should be in the same empirical state that it was when it was collected. That is the first rule of sample integrity, because as a microbiologist, I sit in my laboratory and I want to be as close to the patient as possible, which is not possible physically, but at least the sample should reach me in the same stage. The first is that the sample should be preserved, should be collected well, preserved and transported as per the guidelines, maintaining the ethical infrastructure.
Thank you, Dr. Saxena. I would want to know what is Dr. Mahadevan's view on this as well.
Good afternoon, and thank you, Vikram, for invitation to be on this panel. I completely agree with Dr. Saxena. I think the most important to a pathologist, be it a pathologist, be it a microbiologist, be it a virologist, the integrity is key to our result. So as someone very correctly put it, our results are only as good as the specimen that we receive. Having said that, when I was just listening to Dr. Saxena, it struck me that maybe in a way, the Trimurti of good lab science, if I may say so, would be three gods: the collection, the storage, and the transport. And if all these three are taken care of, you would get the best results. And there are several, I think, who are involved in the responsibility towards this. It's not just the clinician, it's the nurses, the attenders who bring it to us. And if it is from outstation, of course, the courier, the list goes on and on. So I think all of us bear the responsibility towards the best result. Not just them, the patient too has the responsibility in making sure that the sample integrity is preserved. That I would say is the holy grail of a report.
Thank you so much for that insight, Dr. Mahadevan. Moving on to Dr. Kansal. Dr. Kansal, could you share your views on this?
So I would completely agree with Dr. Mahadevan and Dr. Sonal Saxena. And along with this, I would like to share that, as you are aware, that Dr. Lalpat Lab they have a pan-India presence, and we get samples from far corners of India. So definitely integrity of the sample, maintaining the sample quality, the temperature during the transportation, because temperature required. There are analytes which may be, there are very few analytes room temperature you can transport. Minimum the temperature of 2 to 8 has to be maintained. And there are some analytes for which you require a frozen condition, they are stable. So the integrity of the analyte is maintained at the required temperature. So at the point of sample collection, maintaining the integrity, ensuring that the sample is not collected. It is the guidelines are followed at the time of the collection. And it's not only that, the container which we are using for collection of the sample, that's also very, very important. Like there are defined containers in which the sample has to be collected. The sample has to be collected in a proper method in those containers, then stored at a proper temperature. And in addition to that, the centrifugation is also very, very important to maintain integrity, because most of the analyte, once the sample is collected, they need to be centrifuged so that they are separated from the cells. And yes, to give accurate results, all the steps which are required to maintain specimen integrity is very, very important.
Thank you so much for that, Dr. Kansal. Moving on to Dr. Das. Dr. Das, what are the challenges faced in maintaining sample integrity in the lab, and how can they be overcome?
Look, the first challenge obviously is when we receive the sample in the lab. The awareness of the people who receive the sample is very important. So constant training and updation of the staff who are receiving sample becomes very crucial, because especially in a lab, you will receive sample from different segments. We receive samples from microbiology, from biochemistry, from histopathology, and especially in the nights, because you are really staffed during the night. So the person who's going to receive the sample should be well aware what he's supposed to, how he's supposed to receive, how he's supposed to check the integrity of the sample, and how the sample is to be stored. So the sample receiving storage practices should be made very clear to the staff. We have all seen during COVID, it was a very crucial thing how the samples, we all were collecting our samples in the transport media, but we have had issues where the integrity of the samples, these transport media were compromised because not maintained at the correct temperature, not stored at the correct temperature, both while collection, while transportation, and when even after it was received in the lab, because people were not aware, there was resource issues. So these have to be taken care in the lab and ensured for each segment. I think Dr. Anita would highlight what is important in histopath and microbiology, because we a lot of times share samples wherein a biopsy is taken and the sample is collected. One sample is to be collected in formalin and the other one needs to be collected in saline. So a mix-up in both the samples is what we face a lot of times. And then the integrity of the sample is compromised because microbiology cannot grow an organism from a formalin sample. So these are things which lab needs to keep their eye open on when they receive a sample at the receiving step.
Thank you so much for that, Dr. Das. I will get to Dr. Mahadevan on this, but I would want to know what is Dr. Madhura Rekha's view on this.
My view on this is it's very important. I will agree with Dr. Das that the person who's actually receiving the sample, they have to check the integrity of the sample and what is the analysis required for that sample, and to dispatch that sample for the storage or analysis. And that accession, that receiving is very important. Not only that, there are a lot of mistakes happening where the sample name, age, and connected to the sample. Of course, storage and the preservation and correct collection is important, but also naming the sample. Naming the sample correctly, making sure the sample is reaching in the same name and with same integrity. That ensures the final quality of the sample and the result also. The result going to the patient is to that patient. In every report we see, there is a disclaimer. We think that the sample is from this patient. I'm sure all of us have read this disclaimer. So that is the importance of actually making sure all the collection phlebotomists, the transporters, and the data entry accession data entry personals are trained for, where the sample is recorded under the same name.
Moving on to Dr. Mahadevan. Dr. Mahadevan, your view on this?
I think if you ask this question to any of us, we can go on for hours together, Prabhat. But to cut a very long story short, I think the most critical is to know how to send a sample. And we cannot emphasize enough that training and a knowledge of what it is that we want is what dictates how to send a sample. So the clinician should be very, very clear. Do they require only a diagnosis, for instance, like in a tumor? You may think that a diagnosis is good enough. But even in that, we want morphology. We want nowadays moleculars, because personalized medicine is catchword of this era, in which case we would probably want tissue kept fresh. So basically, it's what we want is what dictates how to collect a sample. If they're, let us say, thinking of an infection, I think this is a story that I often tell all my students just to make sure that they get the idea right. We had a patient who had a tumor in the brain. It looked like a tumor on imaging. In the best of imaging, they thought it's a tumor. When they gave us an intraoperative frozen, so they wanted a quick diagnosis, they needed to send us intraoperative tissue, which should not be fixed. It should come to us in saline. When we looked at that, we found what are called as a granulomatous, full of giant cells. And we said tuberculosis, right? The surgeon thought meningioma. We thought tuberculosis. But we also said, please send the tissue to the microbiologist for culture. Because the final word on an infection has to be a culture, which also tells you whether that particular infection, what is the drug to give, how much to give, is it going to be sensitive, cannot be answered by a pathologist, has to be a microbiologist. Unfortunately, it was not sent. And finally, when the histopathology came, it turned out to be a fungus. And we were hard pressed to know what type of fungus. There, a microbiologist would have just taken probably 24 to 48 hours to tell what it was. The patient finally died because in a fungal infection, the treatment is slightly different. They need to give antifungals as an emergency. During the surgery itself, where they remove it, they have to instill antifungal drugs. If you don't do that, then it has catastrophic consequences. So, bottom line of the story is, we all need to be aware of what it is that we want, constantly be on the alert. But I think, having said all that, we need to talk to each other. If we do that, I think many of the problems that all of us on the lab side face is probably taken care of. That's my take on it. So they need to know what they want. We need to know what to tell them to do.
Thank you so much for that, Dr. Mahadevan. Coming back to you again, Dr. Mahadevan, if you could share some light on how can an effective cold chain help in ensuring sample integrity in a lab setting?
Okay, for a pathologist, remember that sample collection is not just about taking it and dumping it into formalin or saline or something like that. There are several things that matter. What the terminologies that are used is what is called as a warm ischemic time and a cold ischemic time. So a warm ischemic time is something that we really don't pay too much attention to. It's the time from when the surgeon cuts off blood supply to removing the tissue is the warm ischemic time. Now, what that can affect is not the morphology at all, but it has a great deal of influence on what happens to the enzymes, the function, basically it's the hypoxia and stress. When you cut off blood supply, it influences all of the omics, be it genomics, be it transcriptomics, be it protein. Right? The second part, after removing the tissue to putting it into a fixative or fresh, is the cold ischemia time, which has a lot of influence, not just on the omics, not just on the molecular integrity, but also on the morphology. Now, that's the time point. And of course, the time it stays in fixation, all of which matter. So the ideal is, if we could, I think the most recent is to use the tissue safe or the vacuum, which makes sure that there is, all the air is sucked out and you can transport it, maintaining protein, maintaining molecular, maintaining morphology. Now, cold chain, as you said it, is probably ideal when we are looking at molecular studies alone, where we want to maintain the integrity of all of our ohms. until it reaches the lab. So what is most critical there is the temperature that you select, whether it is 4 degrees, whether you want it at -20 or whether you want it at -80. Now, in case you don't have the -20, -84 is good enough, but you need to ensure that that 4 degrees is maintained from the time you collect up to the time it reaches the lab. There are, of course, a lot of newfangled gadgets which can actually keep track of the temperature, which unfortunately many of our labs are not able to afford. But that would be ideal state. You have a temperature logger right from the time the surgeon drops the tissue into the cold temperature, set it, keep the logger. Important that at the time that we receive it, we make entire documentation of what temperature it came at. Because if they put it in at 4 degrees and it came to you at room temperature, then the entire exercise is defeated. So I think that cold time is most important for a banker who wants to maintain tissues for future studies, which is, I think, the most important for a pathology lab now. Most of us only think about morphology, but I think we need to think about future because it's all personalized medicine. Tomorrow, a new biomarker may be found, and that is where maintaining the cold chain is very, very critical.
Thank you so much for that, Dr. Madhavan. I would want to pitch the same question to Dr. Saxena as well. Dr. Saxena, how can an effective cold chain help in ensuring sample integrity in a lab setting?
For microbiology, cold chain is extremely important because majority of the pathogens are either going to die or they are going to multiply. Either of the things happen. If you leave a sample which has a lot of bacteria, they are going to multiply. And something which was say 1000 per ml will become 10,000 per ml. And if you are doing a semi-quantitative estimation, say like for urine or for ET tube, the readings would go haywire. Like ma'am said initially, the result is as good as the sample received. For viruses, if you're transporting for viruses, the viruses are very, very fragile and they will die if the cold chain is not maintained. This we have seen in our experience of COVID, where people would come up and say that your lab has reported a particular negative, whereas he's symptomatically positive. And the first question to ask such people was that where was the sample kept? What temperature was the VTM kept with the sample? So the viruses are very, very fragile. If we have to preserve viruses, we do it at -20 and -80. So you can imagine what a room temperature will do. The other thing is that there are certain samples, even with bacteria. For example, the cerebrospinal fluid that we collect in case of a suspected meningitis, or in case of a area where we suspect certain bacteria like meningococcus or Haemophilus, they are very cold sensitive bacteria. So if you leave these vials in the refrigerator, the reverse is going to happen. You will not get anything in the culture. But if you leave it at room temperature or in an incubator which maintains 37 degrees, they are going to remain alive. So these samples, we always advise our residents and our casualty people that never leave cerebrospinal fluid in the fridge. Leave it at room temperature if you don't have an incubator in casualty. Sometimes what happens is that the cold chain gets break in between and you don't know. So the kind of logger that Dr. Neeta was talking about is actually the ideal thing, because then you know that the temperature of cold chain has broken down and you might suspect something. But sometimes we are not aware that in between the cold chain was not maintained. So this count that we are getting is actually because the bacteria multiplied or is actually pathogenic to man. So these are certain things that we encounter in microbiology laboratories very commonly, especially in a government setup where there is very limited manpower and a very huge patient load. And the patient themselves sometimes collect a sample in such a manner and bring it. Very commonly, I give this example to all my interns. As an intern, you give an instruction to the patient, please collect an early morning urine sample. Now, the intern early morning is probably 7 or 8 a.m. But the farmer who's working in the field or a maid who's going to collect sample, her early morning may be at 4:30 or 5 o'clock in the morning. When they bring the urine sample to our laboratory, and even if it gets processed at 9 a.m. in the morning, it's already a 5-hour delay. So I always tell them, and I want to emphasize this in our forum also, that please maintain this, that urine samples have to be processed within 1 hour of collection. So whether or not they are kept cold or anything will not affect them. If you keep it in cold, then also there are problems. So certain samples require certain amount of instructions to be given very clearly to the patient. So as we say in diagnostic stewardship, the right sample from the right patient at the right time, collected in the right container in the right manner, and transported in the right manner is very, very important.
And yes, Dr. Madhura Rekha, you had raised your hand. You would want to add something to this?
Yes, being a mass spectrometrist and omics for the last 20 years, cold chain is very important in biochemistry and analyte analysis. Dr. Mahadevan has actually emphasized the in situ frozen sample for either biopsies or for biological fluids make a lot of difference in biomarker identification and also for screening. Not only that, when you talk about routine analysis for vitamins and drugs, this becomes very important. Whether the serum is collected in time, whether the clot, how much time the person has allowed the sample to clot, and how much time the serum is collected, and when it was frozen. All these factors actually come down to whether the vitamins or the drugs are analyzed in a correct way in the lab.
Thank you so much for that, Dr. Madhura Rekha. Moving on to Dr. Kansal. Dr. Kansal, my question for you is, what are the different preservation methods?
So, preservation method in biochemistry, see, there are different preservative. Urine sample is one when we are collected, because urine chemistry is used for various disorders, to diagnose various disorders. Primarily urine, we require different kind of preservative. Like sometimes the pH we have to maintain. There are certain analytes which are stable when the pH of urine is acidic. For example, when we are measuring calcium, it's very, very important that pH of the urine is maintained at a. So we advise, we have given collection guideline where HCl, that is hydrochloric acid, has to be added in the urine sample to keep it on a acidic, because calcium generally forms salts with oxalate in the urine and it precipitates. So if the pH is not maintained, you may get very, very low level of calcium when we test. So for some other analytes like VMA, metanephrine, these analytes, they are used for diagnosis of, like, suppose a patient has a very high hypertension, clinician wants to know if there is a tumor because of which the patient is having this high blood pressure, then these particular analytes are measured. There again, the urine has to be maintained at a pH of acidic pH. But then there are some markers which require alkaline pH, like if we have to measure uric acid, or we have to measure phosphorus, then the preservative required is like it should be maintained at an alkaline temperature. So that is why knowledge of this, that what is the kind of preservative required to give accurate result, it's very, very important. And it's very important that we have these dialogues with our clinicians as well as the person who is responsible for collecting samples, so that accurate temperature as well as preservations can be maintained. Then temperature for, again, like I think temperature, they have Dr. Mahadevan, Dr. Madhurika, they already have highlighted. But I would like to share here one experience of ours for maintaining temperature, like the kind of analyte we use. Like IL-6 was a new marker when COVID came in. So we had very little experience with interleukin-6. But what we observed that for that particular analyte, temperature maintenance is very, very important to maintain integrity. Because if sample is left over room temperature, the value becomes thousands times high. We observed that practically. We conveyed it. Then that was the time we really educated all our clinicians and all our phlebotomists the importance of temperature. So these are in biochemistry. I think these are the main preservatives: temperature and sometimes maintaining pH. These are important.
Thank you so much. Moving on to Dr. Madhura Rekha.
Yep.
Dr. Madhura Rekha, if you could share some information on how can the precision and accuracy of equipment be ensured?
So the precision and accuracy can be ensured by doing QC samples regularly, at least 4 times a day. That helps us make sure that the instrument variability with temperature and humidity in the chemicals used or for the instrument electronics, the small variations are negated. The QC runs that are run in between samples throughout 24 hours, that makes the precision and accuracy of the instrument perfect. For us,
Yeah.
being a mass spectrometrist, calibration of the instrument, ensuring the temperature of the room is very, very important for us, because light temperatures also make a large difference in the concentration of the analytes.
Circling back to Dr. Kansal, if you could share some information on this.
So when we talk about accuracy and precision of the results, ultimately there are two components to it. One is that instrument level, and another is the analyte which we are measuring. So many times I have seen when we ask, like when I go for audits and I ask calibration of the instrument, so it gets the people, they get confused with the calibration of the analyte. So I would like to highlight here, when we say calibration of the instrument, that how do we ensure that the instrument is giving accurate result? Definitely on a day-to-day basis, as Dr. Madhurika said, QC is the way which we use to ensure that results we are giving are accurate. But it's the 6 monthly or quarterly every quarter maintenance of the equipment, which is very important, which is done by the instrument provider. So we should be aware that for every instrument, we have to calibrate instrument in terms of the temperature, because the instrument maintains when the reaction is happening, reaction cell need to maintain a temperature of 37 degrees centigrade. Reagents are stored at a temperature of 2 to 8. So we externally, we all know that to maintain a room temperature, our thermometer should be calibrated. And we all do, as although all the accredited lab, they do know that the temperature equipment they are using, they have to be calibrated, but they forget that the instrument, automated instrument which we have, they also have temperature storage devices, they also need to be calibrated. Then they also have pipetter. When we are using a manual pipette, we will do the calibration, we will ask an agency to do the calibration. But the calibration of that particular equipment, which is pipetter in the instrument, that also need to be calibrated. So generally, these instrument provider, they have a complete checklist that when they come for maintenance of the instrument, what all they have to do. So it's important that the user is aware of. They should always ask the instrument provider that you share the preventive maintenance checklist with us, so that they are aware what all they supposed to know. Number one. Number two, after doing the maintenance, they have a performance check, that how do they have done the maintenance. They are saying that they have calibrated the instrument, but then there are certain protocols which they need to follow, which gives a report that what is the acceptability criteria. So they one should always ask them that, okay, once you have done it, you share the reports, which gives us a confidence that the results are accurate. So that's very, very important when it comes to maintenance of the instrument or calibration of the instrument.
Thank you so much for that, Dr. Kansal. Dr. Das, you would want to add something to this.
We usually, when we talk about accuracy and precision, we usually land up in hematology and biochemistry. Somehow in microbiology, it is missed out, but in microbiology, it's equally important, especially because when we are doing now, we are shifted to automation and we do our drug accessibilities and identification on instruments. So what Dr. Nimi told about the biochemistry instruments, it replicates on the microbiology instruments also, including the infectious serology and molecular biology. That is one thing I would want to tell all the microbiology students who are there, that even for your manual steps, you need to put the same checks and balances, because humans also may not be as precise and accurate as instruments, but some amount of accuracy and precision is expected in the reports. So it should not be that it is out of our syllabus. It's very much there in our syllabus.
Thank you so much for that, Dr. Das. Coming back to you again, if you could talk about what are the potential consequences of compromised samples.
Yeah. The consequences of a compromised sample is that you probably do not, the correct report does not reach that's the final outcome of the problem. But the important thing is that how do you mitigate the consequences which you expect not to reach the patient is what is important. Because, a wrong report can be catastrophic for the treatment. It can be something as simple as an antibiotic which was supposed to be reported as sensitive has been reported as resistant. We understand that probably they would give a different drug, but you don't understand what catastrophe and what consequence it can have to the patient, especially in a private setup. Antibiotic is a cost to the patient. So as soon as you report a drug, a sensitive organisms erroneously due to any procedural errors, you report it as resistant, the patient will spend more on his antibiotic treatment. And the cost increases. So the patient's affordability, the insurance, money, everything gets drained out. And for the actual treatment, the patient is always scampering to collect money. And so the treatment gets compromised ultimately, and probably the patient doesn't reach the end treatment and sometimes even loses patients or is economically so pressurized that the patient is not able to sustain it. So this is the final consequence which the patient has. The role of the lab is to mitigate this and to ensure that a correct report reaches. Lab agreed, the correct sampling is the clinician, but whether the sample was correct, whether it was performed correctly, whether the report was dispatched correctly, and whether it reached correctly the patient is the responsibility of the lab. So this is where the consequences of a wrong report can be catastrophic to the patient. It can increase mortality, morbidity, we all know, and can be problematic. So my view is that it is the end result which is important, and we should be careful on it, because now with medical legal cases coming up, the end result is very crucial for all of us to understand and know.
Dr. Das, again, coming back to you, how can newer technologies like remote monitoring, RFID help in sample integrity?
Look, remote monitoring, surely RFIDs will help you. Remote monitoring, especially continuous monitoring, as we know. Now we have systems wherein your whole containers, including individual tubes, can be RFID'd, and you can completely track where your sample is moving, how is it moving, how fast is it moving, where is it moving, how long it has stayed in the cold storage, what you can completely electronically with AI systems, you can monitor. You can have flags where they tell you whether the sample integrity was maintained, where was it compromised, and as we go on, they will also be able to tell that if this is compromised, how your results would be impacted and how your final outcome would be impacted. As we all know now, in fact, most of the instruments which we use, they have an AI system, intelligence system, where you can detect the mild hemolysis, and the instruments themselves tell that the hemolysis, whether it is going to impact your results, not impact your results, whether the results can be released, not released. So these are, and the track systems, they are completely RFID tracked. When you put them on an automated conveyor belt, automatically the samples are checked for the integrity, they are dispensed onto the instrument which can take up on the instrument which should be allotted to for that sample and can move. So therefore, these are important things which would come up. Integration with AI would surely help us reduce the manual intervention and would help to pick up the loss in integrity, loss in sample, wrong labeling, wrong in tests being performed. All this integrity issues in the whole process can be taken care of with the automation which we look at in next few years. Already we have quite a bit of it, and future looks more towards it.
Dr. Das, once again, but quickly on this, the need for regular audits and inspections, if you could share your views on that.
Regular audits and inspections. Audits are or inspections, whatever you may give it different nomenclatures. You can have your own internal audit systems, external audit systems, but audits are basically intended is you compare your system, what you're doing, with a standard system which already exists. You could use different checklists and do a checking of your system. And the advantage of doing this is, if you religiously do it, correctly do it, it helps you to pick up mistakes. Mistakes happen. There are gaps in the system. So as soon as you keep picking up the system gaps, you improvise them, you do your root cause analysis, put your corrective actions in place, the system becomes more robust. And at each step, the integrity of the sample to integrity of your testing to integrity of the reporting, all can be checked at different levels. And it basically puts checks and balances. And it's like though people don't like auditors, don't like being called as policemen, but if policeman is not there, nobody waits at the red light. We tend to cross. So these are like checks and balances which can be put, and we can help improve our own system.
Thank you so much for that, Dr. Das. Moving ahead, Dr. Mahadevan, how can a regulatory framework help in ensuring sample integrity in a lab across the industry? And how can collaboration with accreditation bodies help to improve quality assurance in laboratory testing?
I think the best answer shouldn't come from us. It's always better to have a third person telling us how good we are. And that is something that an accreditation body, when they come to assess us, helps us to understand. Because if I was to evaluate myself, I would probably give 10 on 10. Because I think what I'm doing is best, which is not right. If you tell me that I'm doing well, that probably carries much more. And that's essentially what an accreditation body does. So it's really good to have a third party coming in, assessing us right from step one to the last step of a report going and what it means to a patient. Very, very critical, I would say, in current day practice, because if somebody is, I think Dr. Das said it nicely, if somebody is watching us, we do a good job. So as to a framework that should go in, I think with NABL coming in, they've done a fantastic job. Initially, I think it was way back in 2012 that we tried to get into this. It was only in 2014 we went in for accreditation. So just having to self-evaluate us was tough. But at the end of it, I think we all enjoyed that journey because it tells us there is so much more scope to improve, to do better at a time when we thought we were doing the best. So that kind of a regulatory framework, if it becomes mandatory for all our hospitals, we are answerable to someone. That I think would be the best way to make sure that we deliver quality. That's what we're trying to do. I think all of us at all levels are trying to give the best that we can. But like I said, it's good to have someone else say it.
Thank you so much for that, Dr. Mahadevan. Moving on to Dr. Kansal, I have the same question for you, and I want to know your views. I will repeat the question. How can a regulatory framework help in ensuring sample integrity in a lab across the industry? And how can collaboration with accreditation bodies help to improve quality assurance in laboratory testing?
So I will echo the same what Dr. Das and Dr. Mahadevan has already said, that accreditation body, basically accreditation in our country is voluntary. So definitely we invite them to come and inspect us, not that they are not imposing accreditation on us. So the fact that we are inviting them, we are ready to be inspected, because we know that in our day-to-day work, we are so busy doing our work, giving out reports, ensuring that patients are getting. We know that at times there might be certain gaps which we may not identify. So if we know that a third party is coming and auditing us, and if we have missed out something, it can help us to improve our processes better. So definitely accreditation has very, very important role in ensuring sample integrated the entire process from sample collection till the reporting time. It's not only sample collection, I think it starts before that. That's the preparation of the patient, which is also again very, very important.
Moving on to, thank you so much for that, Dr. Kansal. Moving on to Dr. Madhura Rekha.
Yes.
How can collaboration with accreditation bodies help improve quality assurance in laboratory testing?
I think they have covered most of the ground, but I would emphasize on the QA and QC personnels in-house. Most of the MNC diagnostic centers and hospitals do have an integrated QA and QC departments, but many of the diagnostic centers that run across our country, they have no idea. Though they go into accreditation, they have third-party helping bodies come and help them do the accreditations, but following a set path written by the accreditation and ensuring it is followed day in and day out is more important. So I would feel that the rules and regulations are made by the accreditation, and it is a great job that they do, and they keep the inspection and auditing is important. But in-house QC person ensuring the process is happening is also very important.
Thank you so much for that, Dr. Madhura Rekha. Moving on to Dr. Saxena.
I think everything has been said by the other learned speakers, and I echo their sentiments. But My first and foremost rule always is that we are first answerable to ourselves then before we are answerable to anyone else. So before getting, an accreditation done, the internal quality procedures and the quality assurance that we follow in our laboratories should be very, very stringent. There should be no compromise on that level. Because what is there is that the results should be reproducible. If a patient gives a sample today to my lab and gets a result, and the same sample, if it is processed in another lab, should be giving the same result, then only my lab is actually, following the set protocols or set guidelines. But usually what happens is that we forget to look inside our house and we go around with the accreditation bodies, which has fair amount of paperwork and fair amount of resources, both in the terms of money, infrastructure, manpower is involved. But before that, I think we should first set our internal quality procedures in a check before going for an accreditation body.
Thank you so much for that, Dr. Saxena. I still have another question for you, though. Could you just share some information on what are the key considerations for ensuring secure transportation procedures for samples?
See, as an academic person, multiple times we teach this to our technical staff, to the people who are transporting these samples, how triple labeling of samples should be done, how they should be put in a cold chain if required, how dry ice should be packed. So there are certain set procedures for this. All the laboratories have a certain SOP, a standardized operating procedures for transportation of a particular sample. So it varies from sample to sample, what kind of conditions it requires. And the packaging, the first and the foremost rule is that nothing should leak out because it is a biological material. So even if it is a sample which is, easily obtainable or something like urine, even that or blood or any biological material should not leak out. So first and foremost, it should be in a leak-proof container and it should be packaged as per your laboratory SOP, whatever you have in place, and it should be implemented. At every place, making the law or an SOP or a guideline is very easy. It is the implementation which is the more difficult part. So there, I think regular training, teaching, emphasizing in all interactions that correct transport is important and it can affect the results that you're getting is very, very important. Thank you.
Thank you so much for that, Dr. Saxena. My next question is for Dr. Kansal. Dr. Kansal, if you could talk about what are the key components of training programs on sample integrity, best practices?
So key component, Prabhat, would be same what we have been discussing, that first, we should educate that what is the right sample type which is required, then what is the right container in which sample is to be collected, what is the method, how the sample has to be collected, then what is the temperature on which sample has to be transported. Then the stability is also very, very important, because some analytes may be stable for hours together, whereas some analytes are stable only for 2 to 3 hours. So it's very important that we define very clearly that what is the stability at room temperature, what is the stability at refrigerator, or whether that particular sample is stable at a frozen temperature. So defining the type of specimen, defining the temperature required, defining the time required, and the transportation guidelines. All these components are very important when we talk about, and preservative, we talked about, we also spoke about preservative, that what kind of preservative which are required to maintain integrity of the sample. So all these components, each and every component is very important when we give training.
Thank you so much for that, Dr. Kansal. So my question is for Dr. Saxena. What are the ethical issues associated in sample collection and reporting? If you could share your views on that.
Yes, there are multiple, ethical issues. One is the patient confidentiality. There are 3 C's as we talk about for most of the issues. The report of the patient, the collection procedures, they should be reported back either to the treating physician or to the patient itself and not to anyone else. The second C is about the consent. Many times what happens is this, we encounter this when our postgraduate students do research, and many a time they come to us and say that we collected this sample for serology of SARS-CoV. Now can we use the same sample to do Vidal? Without the consent of the patient, you cannot use that sample for research. So even if you have a sample bank collected to you, either you have to take an ethical committee waiver or you have to take the consent of the patient that if you can do another test on it. This is sometimes very highly misunderstood by people that, this is happening, and it's only in sometimes our own physicians are of the belief that it's only HIV where we deal with these consent and confidentiality issues and do not deal it with the other samples. But keeping that in mind, I think National Medical Commission has made these changes in the MBBS curriculum itself now, where we teach students what are the ethical issues which are associated. If you label a patient sample wrong, there is another problem, but it may be a problem for the lab. But if that sample gets discarded by the lab, then aren't you ethically doing something wrong to the patient? The patient services get compromised. So precise instructions to your nursing orderlies, to your phlebotomist on labeling, on transportation, everything then becomes an ethical issue. And of course, confidentiality, consent is part of the sample collection procedures for all diseases, for all conditions.
Thank you so much for that, Dr. Saxena. Moving on to Dr. Mahadevan. Dr. Mahadevan, I have the same question for you.
I don't think I can state it better than what Dr. Saxena did. Just to flag one issue that she raised, which I think is very important.
Absolutely.
I am a banker, right? So being in a teaching institute, I think it's also important that the samples that remain after testing should be made available for education, teaching, training, and research. And that's something that took us a lot of sensitization at the level of the ethics committee, at the level of the patients themselves and their relatives, as well as the doctors themselves. Because at the end of the day, you're going to throw that sample. That same thing it's worth its weight in gold, I must say, for somebody else who wants to do research on it. So when we started talking to our ethics committee, it was a completely different way of thinking for them. It took time, but they said yes. But I think what was the greatest challenge was telling our doctors how important it is that we retain the additional samples after testing. The easiest part of the path, I think, was talking to the patient relatives and the patients themselves. They were more than happy to say, hey, you've taken sample out of me, you're not going to put it back and give it to me. Use it. But I think the key to the entire thing is open communication, getting their consent, and then storing it. So even if it's a difficult journey, it's worth the entire effort. Yeah.
Thank you so much for that, Dr. Mahadevan. Would anyone of you like to add some concluding remarks here?
I think, Prabhat, we are more than good. It's a great initiative, and I think all of us will agree that it's been a great learning from each other. But hats off for having this initiative.
Thank you so much for that.
Take this forward by having something permanently online where Q&As can be put. And
before we can go and end this discussion, I have a few questions for you all. These questions are from the audiences. You all can choose who wants to answer it, or you all can give us multiple answers. First question is, urine sample received in boric acid container for culture should be processed within how much hours if delay in transport? I think I should target this to Dr. Kansal.
I think a microbiologist should answer this question, Dr. Das.
Okay.
Prabhat, if I remember correctly, boric acid, though in my present organization, I'm not using it, but earlier it was 24 hours. Within 24 hours, the urine can be used. Otherwise, it is 1 hour, but with boric acid, you can extend it up to 24 hours with boric acid. Usually the manufacturers, I think, I'm not preaching any brand, but Becton Dickinson is one of the largest producers of boric acid tubes. Now you have some local vendors also which are available. So they also define what is to be used and how their product is to be used. So follow the manufacturer's instructions also parallelly.
Okay.
Actually,
Thank you so much.
nowadays we don't teach using boric acid as a preservative for culture. It was an earlier done path.
Okay. Thank you so much for that, Dr. Saxena. The next question is for anaerobic culture samples, the cold chain transport. What is the significance of cold chain transport?
I can take that. For anaerobic sample, it is most important is that do not expose them to air rather than the cold chain, because the samples are the same from where you are culturing. If you will either get pus or tissue or deep-seated wound aspirate for anaerobic culture. Now, these samples should not come in contact with oxygen. So you can use a pre-sterilized tube for it, or very commonly what people do is that they cork the syringe with which they have taken out the sample so that the air doesn't enter, or use a transport media to transport these samples. The best is to put it in Robertson Cook media, which is a transport media, and then send it to the lab for anaerobic culture. It is better to not put it in fridge or any other place. These samples will have very little bacterial load. So it's better to culture them as fresh as possible. As I said in my opening remarks, I want to be close to the patient.
Thank you so much for that, Dr. Saxena. One more question, and can one of you throw some light on the formalin fixed embedded tissue storage and preservation?
Yeah, that's a most difficult question. I don't know who asked that. But remember, formalin is the holy grail of pathology, right? It's a very close friend as well as an enemy. Now, for our morphology, all of us use formalin. But remember that keeping it for too long in formalin is absolutely not good. That's the fixation time. It may take care of morphology, but now we are in the molecular era. It's going to kill all of that. So as short a fixation as possible. Also remember, it affects your immunohistochemistry, which all of us use now, day to day. I think a lot of studies on ER-PR, and they say even more than 2 hours in formalin, your ER immunoreactivity just falls, and by 8 hours, it's gone. Okay. So you have to be really careful that you optimal fixation time, not too long. But just in case there is going to be a delay, because Sundays are Sundays the world over, what you could do is keep it at 4 degrees. It actually prevents degradation up to 24 hours. So formalin fixed tissue, you can keep it in the refrigerator. Now, I think you said formalin fixed embedded blocks itself, which is wax blocks. Wax blocks are like Egyptian mummies. You can keep it for decades, nothing happens to it, as long as your cockroaches don't get it. For some reason, cockroaches seem to like paraffin blocks. So keep it in a safe Godrej almirah, in a steel almirah. Make sure it's not accessible. But having said that, there is a lot of information now that your immunohistochemistry from FFP blocks. We can even do now DNA and RNA extraction from FFP blocks. Those may not be preserved. So current thinking is keep that also at 4 degrees. So if you can get a walk-in cold room, nothing like it. I have one in Nimhans. We're not storing our blocks there, but all our formalin fixed brain tissues, which I believe lose sleep over, everything goes into 4 degrees. So that's a great way of preserving it. It reduces the conversion from formaldehyde to formic acid. So that's how it preserves tissue. I hope that answers your question.
Thank you so much for that, all the panelists. It was great having you all together. Thank you so much for your time. Thank you for joining us.
Our pleasure, I think.
Yes.
Thank you,
Pleasure
Prabhat.
having you on board. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Quite.
That's to the whole ET team. Thank you.
Yeah.
Thank you so much for that, Dr. Mahadevan.